we receive our vaccine direct from Pfizer, and that distribution is regulated by CDC, which basically dictates down to the states what their allocation is. And then MDHHS, Michigan Department of Health and Human Services, dictates how that's distributed across the counties in the state. We've been receiving just under 2,000 doses per week, which is a little frustrating, considering that we have redeployed our staff, reallocated our resources in order to bring our capacity up, our vaccinating capacity, to about 20,000 per week. And yet we get only 2,000 per week. We get 1,950 doses per week. So, there's nobody to blame, really. Understand, Pfizer's making the stuff as fast as they possibly can. They're supplying the entire planet with vaccine, just as Moderna is. And, MDHHS gets a limited supply every week, somewhere between 60 and 100,000 doses for the entire state. So, that the fact is, the entire world will be frustrated for a while. Everybody would like to have vaccine right now, and that's just not possible. So CDC and MDHHS have essentially provided guidelines for how to prioritize who does receive vaccine. State announced this week, I don't even know honestly what day it is, but they announced that those who are 75 and older can receive vaccine, 65 and older with chronic health conditions. We have 217,000 residents in Oakland County alone, 65 and older. Even if we just talk about the 1A priority group, we're talking about tens of thousands of people. And we have received, fewer than 2,000 doses per week. As of yesterday afternoon, we have vaccinated 4,669 people. So basically, every dose we receive, we stick in somebody's arm. And so far, that has been primarily EMS, healthcare workers, teachers, and police, sheriffs. And again, we've scheduled every dose that we receive. And right now, because we're trying to anticipate, we're scheduling, people for appointments where we haven't received doses yet. So we have to rely on the state to continue sending us vaccine.